Sinus infections affect millions of people in the U.S. each year. Sinusitis is a common condition affecting 20 to 30% of the population, occurring more often with women. We had the pleasure of speaking to Dr. Donald Dennis from ENT and Facial Plastic Surgery in Atlanta, Georgia. He discusses the sinuses and the symptoms that occur with sinusitis.
A sinus is all the air-filled cavities in your face and head. So you have four pairs, so you have 8 total. Sinusitis is an inflammation of those sinuses. It can be from allergy, or it can be bacterial infection or fungal infection, or both. They'll have facial pain, headache under the eyes or over the eyes. They have a runny nose or nasal congestion, inability to breathe through the nose, loss of smell, postnasal drip, and then it'll last a long time with chronic sinusitis, up to 3 months, and with treating with antibiotics and recurring, or 4 different episodes a year requiring antibiotics is what chronic means. Chronic sinusitis is about 50 million people altogether. Those are the ones that have it repeatedly after antibiotic treatment. That's the definition of chronic sinusitis. So it's interesting that the definition includes that they must fail antibiotic therapy, which proves it's not all bacterial.
The pain from sinusitis can be severe.
The pain is caused by the sinuses are swollen shut. The opening to the sinus is blocked, and so you get back pressure in there, and that causes the pain.
Dr. Dennis compares acute and chronic sinus infections.
There's 2 kinds, acute and chronic. Acute, it could be anything. You just get a cold or a viral infection and it's gone. You don't have it anymore. The chronic is more commonly caused by fungal immune reactions. And they'll have a secondary bacterial infection, so most people will treat the bacterial infection. And if it keeps recurring, it's more likely that it's fungus, because antibiotic would have gotten rid of the bacteria.
Treating a person for fungal infection in the sinuses also includes the air they breathe.
You got to get rid of the fungus in the sinuses, but more importantly, you got to get rid of its source, which is twofold. Number 1 is the air, and number 2 is the body, because once they've had all those antibiotics, they usually get a gut full of yeast, and that's also a fungus. So they got to change their diet and get on a low-carb diet, and then we got to kill the fungus in the sinuses by irrigation with salt water and citrodrops, which is an antifungal, viral, and bacterial, and then we give them a nose spray that's antifungal. One is citrodrops, or also a number of other ones that are antifungal, and sometimes they need decongestants or antihistamines, but most of them, if you get rid of the fungus, the congestion stops. There's an immune support thing called sinus defense, which is helping the antibody levels for those organisms go up in the blood by transfer factor, which is in that spray. And that makes them more resistant to the fungus and the bacteria.
Dr. Dennis discusses a resource for learning more about chronic sinus conditions.
Microbalance Health is a company that we started in order to help people educate themselves on how to treat long-term sinus infections. And it has all the products that you need for the nose and body, and the ones that you need to clean the fungus out of the air. And then it's just a way that people can educate themselves and start getting some wellness without a lot of prescriptions.